a third dose 6 months after your second dose.
Israel has already vaccinated 2,000 immunosuppressed people with a third dose.
Moves by some countries globally to introduce booster shots threaten the promise of a brighter tomorrow for Africa.
More than 6 billion doses of COVID vaccines have been administered globally. Now, superficially, that looks good, with 44% of the world's population having had at least one dose. But that hides a gross imbalance. Most have gone to middle and high-income countries. Only 2% of people in low-income countries have had at least one dose. That statistic is at the core of opposition to vaccine booster doses.
We need to get more people having their first jab right around the world before we worry about third doses, which are like giving, as the WHO says, a life raft 3 times over when many people don't have their first life raft.
Much of the impetus for boosters has come from Israel, where they've been observing declining levels of COVID antibodies in immunised people aged over 60. In late July, they began a booster program which now extends to anyone over the age of 12.
When we look at the numbers of the immunity after 6 months for people that got only 2 doses, we see that that went down to 20 to 40%. So we're going to say 30% in average of protection from symptomatic disease. But when you get your booster shot, after 1 week, it goes up back to 85%, and after 2 weeks, around 95%.
Israeli researchers recently published their early findings on boosters in over 60-year-olds.
We can clearly see that if you are vaccinated with a booster shot, your chances to get into severe conditions are 10 times less than if you are vaccinated only with 2 doses.
It's results like these which have prompted several countries to implement booster shots. But in the United States, that's been divisive.
The decision of which booster shots to give, when to start them, and who will give them will be left completely to the scientists at the FDA and the Centers for Disease Control.
The trouble for the administration was that 2 expert committees, including one at the Centers for Disease Control, only recommended shots for a limited group of Americans. But late last week, the director overrode that expert advice.
Had I been in the room and on the committee, I would have voted yes. And that is reflected in my resulting decision to allow the use of Pfizer-BioNTech COVID-19 booster dose for those 18 and older at high risk of COVID-19 exposure and transmission because of occupational and institutional exposure.
This is not our first emergency.
Dr. Walensky opted for boosters for the over 65s, younger people with underlying health conditions, and frontline workers. But some say that important data are still lacking. Epidemiologist Dr. Ira Longini co-authored a paper critical of boosters.
Boosters have not been shown to be safe yet. They're probably safe, but we don't have the data to back that up. We don't know if boosters are effective, except for possibly very short term.
A lot of this hinges on the Israeli data, which have been criticised for not being representative of the population as a whole.
Yeah, I can understand the criticism. I would say the situation is clear. If you get your booster shot, you are less at risk than people that got 2 doses. So I don't think that there is such a huge bias. True, I agree. We would have preferred to have more time in order to make better assessments. And I can tell you personally that more studies are coming.
So what about us? Infectious diseases expert Professor Robert Boy says that double dose protection is strong and sustained.
Quite simply, if you have any vaccine, whether it's in a young child, an adult, or an elderly person, the antibody level peaks after a month or 2, and it always declines over the next 6 or 12 months. That's nothing new. We expect that to happen, but the protection that you get is maintained.
Important new data just released from the UK tell us more about protection against COVID infection. Your defences are better after vaccination if you're younger and if you've already had a COVID infection. But it also shows that Pfizer protection does decline by about 20% per month, while interestingly, Astra protection seems to be sustained.
I would say very strongly that people who've had 2 doses in Australia, even if they're in the front line and their antibody level is declining, they will still get good protection against Delta, and they will continue to get good protection over the course of the coming months. I don't expect them to need a booster. I think it's wasteful. I think it's potentially immoral.
One group who almost everyone agrees deserves a 3rd dose of vaccine are people whose immune systems aren't working well.
It's really important to emphasise that people who've had chemotherapy, high-dose steroids, bone marrow transplant, they may not have responded at all to the first 2 doses. And about 1/3 to 1/2 will respond to a 3rd dose. So it's important to cover off on the immunosuppressed people really well, and they do need a 3rd dose sooner than anyone else.
Meantime, ATAGI, the Australian expert advisory group on immunisation, has said they're watching what's happening overseas, while hinting they may move earlier on boosters for the immunocompromised.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.